Nigerians are bemoaning the state of health infrastructure in the country, stating that 56 years after independence, medical care in the country is still at its infancy. It was argued that the yearly national health budget has never met the demand of the scale-up of healthcare services, and government's policies on the environment have not provided the needed incentives for the scale-up of private sector participation in health service delivery. They challenged the federal and state government to pay special attention to the plight of retired civil servants and the aged in the country, saying Nigeria will reclaim its position as the giant of Africa if critical infrastructure in the health sector are given adequate attention.
The situation of Nigeria today is pathetic. People are dying because of poverty, and our leaders are not seeing to that. You see, I can say it is an act of selfishness by those who are leading us. But when the Roti found it necessary to come on board,
working somebody that I am retired someone, they don't even care for us. They have care. We will go to the hospital, then say we should pay some amount before they make attend to us. They have prepared that one since last year for retiring somebody from Lagos State Water Corporation.
Others faulted the federal government for not taking the welfare of majority of Nigerians serious. They blamed institutional corruption in the system and urged the federal government to provide adequate health facilities in the country.
If you ask me, though it's my personal opinion, because this was not how it used to be. You go to communities, the cottage hospitals that you used to see everywhere, they are no longer there. Even those ones that are available these days, they are not properly funded.
Say public health in Nigeria is far behind, because I think the government needs to do more to do it. And they don't lay the concentration on public health is very low. We see that in our health facilities, their basic infrastructures are not there.
They highlighted the gross maldistribution of healthcare professionals in the country, resulting in scarcity of skilled professionals in the rural communities where there is greater need. They, however, urged the federal government to provide incentives to encourage voluntary drift of skilled professionals to the rural areas.